Saludos amigos, bienvenidos a esta entrevista especial de Multimedios del Caribe para toda nuestra audiencia. Estamos muy orgullosos de recibir en el país, en Santiago y sobre todo en el Hospital Metropolitano de Santiago al doctor David Samadi, quien es el vicepresidente del Departamento de Urología y también jefe de la Unidad Robótica de Cirugía Mínimamente Invasiva del Hospital Mount Sinai de Nueva York. Estamos orgullosos de recibirlo y en el momento ahora vamos a compartir ciertas impresiones con él de algo que ha maravillado al mundo, que es la cirugía robótica de mínima invasión. Doctor, welcome. We're very pleased to have you in Santiago, also in our country, and most of all in the Hospital Metropolitano of Santiago. How are you?
Thank you so much for having me, and I want to also appreciate the hospitality. Wonderful hospital, and it's been a great trip for me and my team, and I wanted to thank everyone for having us here.
We're so glad to have you here. Doctor, let's start from the beginning. You are from Iran. How did you get into New York and become the chief of this wonderful surgery that is the new procedure now and that everybody's talking about?
Well, I've been very fortunate. I think being born in Middle East and also have lived in Europe, in London, in France and other places, and now close to 30 years in America, I've been exposed to many cultures. And I think that kind of upbringing has allowed me to be able to take care of a lot of patients from every color, from every culture, and be able to take care of the patient as a whole, not just their disease. And that has been really the big secret to our success.
Okay.
I take care of the patients and their families, and that has been a wonderful trip and ride for me for my entire career.
Great. Le preguntaba al doctor cuál ha sido su experiencia sabiendo que viene de Irán y está radicado en los Estados Unidos, específicamente en Nueva York. Y él me explica que se siente muy bien porque ha tenido la oportunidad de viajar a diferentes partes del mundo y de vivir en esas partes y que él trata al paciente como un todo. Trata a su familia, trata las enfermedades que tiene y le da seguimiento. Por eso se siente feliz de estar en Nueva York, pero también poder compartir su experiencia con personas de todas las partes del mundo. Let's start with the difference between minimal invasive robotic surgery and traditional surgery, because when we talk about robotics, our minds go away immediately. Le estoy preguntando en este momento que cuál sería la diferencia que podríamos establecer entre una cirugía mínimamente invasiva hecha por un robot, que es como él trabaja actualmente, y una cirugía tradicional. What's the difference?
Traditional surgery for prostate cancer involves making an incision. As a result of the incision, there is some blood loss and there is longer recovery. So these patients end up having an incision on their abdomen. They stay in the hospital for about 3 to 4 days, and there is long recovery with that.
Okay. Está diciéndome el doctor que las cirugías tradicionales usualmente requieren de una abertura del paciente y por esto se pierde mucha sangre y el paciente tiene una recuperación alargada que puede extenderse.
When we talk about robotic surgery or minimal invasive procedures for prostate cancer, now there is no more incisions. There are small keyhole openings in the abdomen where we introduce the instruments, and we are able to do a very precise bloodless surgery for our patients.
Con la diferencia de las cirugías robóticas de mínima invasión, se hacen unos agujeros pequeñitos en el abdomen del paciente para tratar el problema que tiene de cáncer en la próstata y es posible mediante estos agujeros introducir el robot dentro del paciente. De esta manera es mucho menos invasiva. What's the procedure after you have the whole keys in the patient? What do you go through to get into the...
Well, the whole idea is to remove the entire prostate because there's cancer in the prostate while we're preserving the sexual function and the nerves that are sensitive for urinary control and this sexual function. And that's what you do with a remote control operation. Now, people ask, why do you do it in a remote control? We'll talk about that, but it's
Yes.
a little more precise and the better magnification and better visual.
Yes. Él nos explica que la importancia de esta cirugía de, mínimamente invasiva es que los pacientes siempre se preocupan mucho por la parte sexual y si van a poder seguir teniendo sus relaciones normalmente. Con este procedimiento se toma mucho en cuenta esto y se tiene mucho más cuidado para este procedimiento. Luego más adelante él nos va a explicar en detalle de qué se trata esta cirugía y por eso voy a la siguiente pregunta.
In open surgery, I was counting on my fingers. I had to touch the specimen, feel the specimen in order to be able to do the operation. Since there's a lot of blood in the field in traditional or open surgery, it was very difficult to really feel where the cancer is. My fingers cannot really detect where the cancer is. Now with bloodless field, but since there's no blood in the field, I can bring the specimen so close to my eyes, be able to see it. If you can see it, you don't need to touch it.
Great. Nos explica que en la cirugía normal, en la tradicional, él con sus propias manos tiene que tocar la parte enferma del paciente, donde está el cáncer, y es un poco peligroso y a la vez difícil porque hay mucha sangre dentro del paciente y es visualmente casi imposible. Con esta cirugía mínimamente invasiva, utilizando un robot, es más fácil llegar hasta la parte afectada y sobre todo manejarlo con mucho más cuidado. So is that what it's called, the Da Vinci system?
That's exactly what it is. It's a robotic surgery or remote control operation for removal of prostate cancer, and now we're using it for bladder cancer and kidney cancer. But the importance of the technology is really the experience behind the technology, meaning that the technology itself is a good one. You have a nice range of motion, you have better magnification, but you need to have the experienced team and experienced surgeon behind this Da Vinci to be able to get the kind of outcome that you're looking for your patient.
La importancia del sistema está en que puede llegarse al problema de cáncer del paciente, pero también se tratan problemas de la vejiga del paciente y se puede ver todo mucho más de cerca, además de que la recuperación es mucho más avanzada. So we're talking about a real robot. You go through the patient through a robot.
It's interesting that you asked that question because when people talk about robotic surgery,
I imagine a big machine and it's kind of weird. Le estoy preguntando que si es realmente un robot con lo que él trabaja, porque resulta muy impresionante imaginar un paciente sobre una cama tendida y un robot manejando pues este caso.
I know exactly what you're thinking. People think about this button that you press,
Yes.
the robot goes to work, and next thing you know, the prostate is out. Well,
Yes.
guess what? The robot is not doing the operation. It's the surgeon that has control over the operation. So I perform the entire operation, and that's under my control. But we use this robot. It's about 10 feet away. There's a camera inside, just like the camera that's watching us. And now I can move the camera in the very blind areas, sensitive areas that we couldn't reach. And now I'm able to put the light, be able to see what we're doing, look for those sensitive nerves, and do a very precise and elegant operation for our patient.
So how far from the patient you are while you perform the surgery?
I usually sit about 8 to 10 feet away.
O sea, nos explica que hay un robot que hace el trabajo, pero que es totalmente controlado por él y por sus manos, que usualmente él está ubicado a 10 pies del paciente, 10 feet.
About 10 feet away.
De 8 a 10 pies de distancia, pero que tiene un control total, porque lo está viendo todo a través de una pantalla. Is it a 3D technology what you use?
It's a three-dimensional view. It has 6 to 7 range of motion, so I can move the instruments exactly like the way my arms move. I'm able to really bring the surgery so close to my eyes and be able to see the most detailed part of the surgery, whereas years ago in open surgery we were not able to see. And that really has revolutionized the entire field of surgery, specifically for prostate cancer and other oncology cases.
Claro, él nos dice que tiene un rango de moción o de movimiento bien amplio. Tiene 6 movimientos en los que él puede mover sus manos o mover el robot como si lo estuviera haciendo él mismo con su propio cuerpo. Y la importancia de esto es que no solamente se habla de la próstata, sino también de la vejiga y de muchísimos órganos que podrían verse afectados.
So what we've done is really we've taken the experience of open surgery or traditional surgery. We have brought in the laparoscopic skills that we learned in Europe and other countries.
The usual laparoscopic
Exactly
skills.
right. And now we're using the robotic technology to really bring all the fields together. And that makes a lot of sense.
Sure. Él explica que han utilizado los métodos tradicionales de laparoscopía que se conocen a nivel internacional, pero que lo han llevado a otro nivel, y eso es lo importante, que se ha combinado lo básico con todo lo que puede brindar el robot y la tecnología a esta cirugía. Entonces, I would like to know now, which are specifically the benefits for the patients who go for this surgery?
Typically what happens is the patient comes in on the day of surgery. I start the case, let's say, at 7 a.m. By 8:30, an hour and a half later, the surgery is finished. This involves a general anesthesia. They will be in the recovery room by 9 o'clock. So an hour and a half to 2 hours of operation. They will stay overnight at the hospital, and they will get to go home the next day. So only one night in the hospital.
One night.
One night.
Okay, that's one. Let me translate that.
Sure.
Le estoy preguntando cuáles son los beneficios que puede obtener un paciente si opta por esta cirugía de mínima invasión robótica. Él me explica que aproximadamente 1 hora y 30 minutos solamente tomaría esta cirugía y que luego el paciente pasaría a un área de recuperación y que al siguiente día estaría disponible a irse a su casa. Para mí eso es algo increíble y maravilloso. What other benefits can the patient experience?
There's no blood loss. The average blood loss in our hands is anywhere from 50 to 75 cc, whereas in traditional surgery was somewhere in the range of 500 to 1,000. So
On a regular?
in a traditional open surgery. So there's no blood loss. As a result, there's no transfusion. There's no risk of getting hepatitis or HIV from the transfusion. There's no pain involved. They have some discomfort, but there's no pump for morphine or any major pain medications.
Me dice que otro de los beneficios que ofrece este tipo de cirugías es que no hay mucha pérdida de sangre dentro del proceso. Solamente de 50 a 75 cc de sangre pueden ser perdidos comparados con los 500 que serían en una cirugía regular. No hay riesgo de alguna transfusión de sangre que pueda contaminar al paciente con hepatitis. O sea que hay un mínimo de riesgo en cuanto a la sangre se refiere, que es una de las cosas que más miedo les da a los pacientes. That's one of the things that people fear the most, right?
Well, they're afraid of the transfusion and the bleeding. So if there's no pain, there's no transfusion, and there's minimum incision, there's no real opening in the abdomen, they end up going back to work much earlier. So the quality of life is completely changed, not only for them, but also for the partners and the wives and the family. And that's a big part of this.
Amazing. What other benefits they have? They can go home early, they don't have the...
Of course, the biggest and most important part of the work that I do is not only just cure them from the cancer, but it's also the urinary control and the sexual function.
Okay.
Now, years ago, every man that would hear the word cancer, especially prostate cancer, they thought this is the end of their life.
Yes.
And this is a death sentence. It's important for them to know, if they're watching this program, that you don't have to die from prostate cancer, number one. Number two, the sexual function, we have our own technique that we have developed that would preserve those nerves that are responsible for sexual function and urinary control.